Okay, now to your health. You know, the pandemic has really taken a toll on our mental health, with many falling into depression.
Well, this morning we're digging into a non-invasive way that doctors are now treating the condition. It's called transcranial magnetic stimulation, or TMS. Joining us live to explain how it works is Dr. Preetham Raj, Chief Medical Officer at Active Recovery TMS. Good morning.
Good morning. Thanks for having me.
Yeah, thanks for joining us. Okay, so first off, let's talk about it is Mental Health Awareness Month. How common is depression? How many people are dealing with this?
So that's a tricky question because pre-pandemic, we were seeing numbers around 7% of society had depression or struggling with depression. But post-pandemic, numbers from the Journal of the American Medical Association talk about numbers 3 times as many. So it really has impacted, the pandemic has impacted rates of depression.
Wow. It just
Wow.
goes to show everyone can experience it at some point in their lives, whether you've had it before or not.
Yeah,
Just because you haven't ever felt depressed before doesn't mean you can't,
you can be
deal with it
triggered.
now.
Right.
Yeah.
And so, what is this TMS, the treatment resistant depression that you practice?
Yeah, so transcranial magnetic stimulation, most people, when you hear magnet, you think MRI, magnetic resonance imaging studies that take pictures of the brain. But TMS is using magnetic energy to actually transfer the magnetic field and the energy associated to the left side of the brain, the left dorsolateral prefrontal cortex, which is one of the depression centers in the brain, and rapidly stimulates that part of the brain to then affect other depression centers and treat depression.
Huh.
Hmm.
It's fascinating. I
Yeah.
mean, so when you talk about seeing patients with treatment-resistant depression, is this something for someone who has tried other medication, has worked with a psychiatrist, and what they're able to take just is not working?
Indeed, Emily. So usually we define treatment resistant depression as people who have failed 2 or more treatment modalities. So
Mm.
typically we think about medications that have failed for depression, but that also includes psychotherapy or talk therapy. If that has failed and people have given it, multiple efforts to try and treat their depression with usual means, that's when we find that we need alternative solutions, because the chance of us getting somebody to remission from depression after, say, 3 or more treatments, it falls to below 7%.
Hmm.
So we need treatment alternatives that are different, and that's what TMS is.
Yeah. And so, for a lot of people, they may be wondering, what is the cost of doing this, or will my insurance plan cover it? So, what are the answers to those questions?
Yeah, Jenny, I mean, the unsung report about this treatment is that it is covered by most insurance companies, including Medicare. We're one of the few treatment centers that actually accepts Medicare into our practice, and it's most commercial insurance see the value of TMS, and so they do cover this treatment.
A question about that. Do you usually have to fail the other treatments first, like the other methods, before you can then try this?
Yes, and it depends on the insurance company of how many medication or treatment failures you need.
Hmm.
But in the case of Medicare, it's typically just one medication failure. And so it's kind of interesting.
Yeah.
Yeah, it is. Now, for anyone who has taken anything or who has undergone treatment for depression before, they know that a lot of the medications can have some side effects. Things like, nausea, getting into and out of those medications can be difficult for a lot of people. Are there side effects with TMS?
Yeah, that's a great question. The main side effect, so to speak, that we talk about with TMS is, in order for the energy to get from the machine into the brain, guess what it has to pass through? The scalp and the skull. And sometimes there is a tapping sensation that can be pretty prominent. I usually describe it as a small woodpecker pecking on your head while the machine is on. And so that's the general primary discomfort that people experience initially, but they quickly adapt. I can only think of just a few people who couldn't tolerate the procedure because of discomfort, but
Oh.
typically you just get used to it, and that's the main side effect, so to speak.
Oh, yeah.
That is fascinating.
Yeah.
It's really interesting to learn about. Look, as someone who has struggled with depression themselves personally, I can say that you know, it feels when you're at your lowest like nothing's ever going to help, but you really do just have to reach out and talk to people and seek out treatment options, because there is another side to this, you know, and things like this are out there for people who need it. Well, thanks for breaking down TMS for us, Dr. Raj. Have a good one.
Thank you. Thanks again.
Yeah, and Active Recovery TMS, if you want to learn more, has 6 locations all across our area. So you can check out their clinics and learn more about this treatment. We'll put all the info for you on KOIN.com.